apply. Okay, so what's going on here? Pyelonephritis, we know it's bacterial infection of kidney. We know that. So it start from the UTI and then keep moving upward, and then it affect the kidney. Yes. Okay, so obtaining urine culture before first dose of antibiotic. Yeah, definitely, because we need to identify whether what kind of bacteria we are dealing with, so we can get the effective antibiotic. Start broad spectrum IV antibiotic immediately after culture. B is a no or yes? I think B is yes. Okay, because we don't want to wait for culture's result to come back. It's gonna take a lot of time to know what's the actual cause behind that, what's the actual bacteria or infection behind that. So in the meantime, it's good to start the broad spectrum antibiotic. Okay, so because it can help us to reduce the or prevent the infection. Yep. Okay, what about C? What about C, guys? 3 to 4 liter oral fluid if not contraindicated. What about C, guys? To flush it out? Yes, this is definitely okay. We can actually do C if not contraindicated. So this is the key word here, because if not contraindicated, we need, because urine actually gonna help to flush out the infection. Okay, and we do need enough fluid, uh, and just to flush the bacteria, just to maintain the kidney function, because if patient is dehydrated, then it can impact the kidney function also. So please make sure, unless someone have like a heart failure or a kidney failure, then it's contraindicated. Okay, then we don't need to give that, but otherwise we can encourage oral fluid. Okay, apply warm compresses to the flank. What about that one? What about D, guys? No. Okay, no, it is not. We don't want to do that. Hold all antipyretics to avoid masking fever. What about E? Do we need to? Is fever management important? Yes. Okay, fever management is really important. Yeah, so it will improve the patient comfort, it will reduce the physiological or metabolic demand. So definitely. Okay, so E is correct, or not correct, sorry guys. uh, Monitor for sepsis sign. Yeah, because patient is at higher risk of urosepsis. Definitely. Okay, so we need to monitor for like such as rapid heart rate, low blood pressure, septic shock. So we need to watch if patient is going into septic shock or not. Today's live all gonna be around kidney disease, kidney medications, kidneys nursing consideration. So it's all renal system. Okay, so please be with me. We finished cardiovascular yesterday and day before yesterday. This morning we done maternal health and pediatric health. So this is actually second session of the day. So please be with me. Okay, I will post all these links over the. I will post all these links and videos on YouTube Nursing channel. Electrolytes, we are gonna do separate electrolytes. There will be few question in this one, not many. Okay, MIA. There will be definitely, we are gonna do ABG electrolytes separately. There will be session coming soon on that one. Yeah. Course for calculation, definitely we can do calculation tomorrow, or maybe we can do some today also. Let's see how we are doing with this. Okay, yeah. Okay, the nurse received lab result of a patient with chronic kidney disease, stage 4, guys. which finding should be reported to the provider? So we know CKD is progressive, CKD is reversible when especially it's stage 4 indicate like it's severe kidney damage. Yeah. So when patient having kidney disease stage 4, there is not enough ability to filter waste and maintain the electrolyte balance. Okay, so that's why we need to just see now. So which finding should be reported to provider? Okay, which finding, guys? Is potassium 6.1? What is normal level of potassium? 6.1. Yeah, it's very hyperkalemia. 3.5 to 5, so it can cause the arrhythmia, so we need to definitely report potassium. What about phosphate? What's gonna happen with phosphate? Yeah, it's higher. Yeah, so we are having 2.9. Okay, so that is high, already written high, so we're definitely gonna, because kidney do excrete phosphate, so it's gonna increase the level and accumulation if CKD is happen. What about hemoglobin? 86. Is patient having anemia? Yeah, everyone happy with anemia? Thank you, ESB. Thank you for follow, guys. Because we know patient is now in CKD, one of the role of kidney is to produce erythropoietin. Okay, and that does help with the blood formation. So what's gonna happen? We need to watch for Hg also. Okay, so patient is having anemia, and in CKD there is not enough production of erythropoietin, so that's why it does need to look after. Okay, and what about bicarbonate? Bicarbonate is low, and we know in CKD if bicarbonate is low, patient is going toward metabolic acidosis. Okay, and that is very common complication of CKD. Yeah, so we're gonna report this one also to provider. Yeah, it is. It is actually, because in CKD pros you really don't wanna, you wanna maintain the normal level or bit high, because it can drop really fast. Kidney is not producing erythropoietin, and then body's capability to produce new blood cell is diminished. So we need to watch for that one also. And what about creatinine? Because is it normal? Yeah. Lucas, it depends like what condition going on with patient. But yeah, definitely. Yes, NCLEX has a lab range given, guys. NCLEX have a lab range given, but the only important thing is like why I don't put the normal lab range over here, because it does give us clinical reasoning. Okay, it improve our critical thinking, and we can do proper rational if we are not looking at the normal one. Okay, so this help us to remember, like you guys can see how many time we have done potassium, hemoglobin and bicarbonate in last few weeks, and you guys don't need to see now what is normal range for those one. Okay, yeah, so creatinine I'm gonna cross over, because if patient is having this one, this is okay, and especially with stage 4 CKD, they will have significantly elevated creatinine. Okay, so this is normal, this is okay. And what about calcium? And it's already written like low, so low calcium would, we wanna inform that also. Yeah, so low calcium also, because kidney is the main organ that do the electrolyte balance. Okay, so if there is any electrolyte imbalance, especially with CKD, these are expected, these are common, but due to high phosphate level, um, it can impair vitamin D activation. So that's why we need to look after all the electrolytes, especially when we are looking after kidneys. Okay, let's move to second question, guys. And that's why I'm saying, like, once we will finish with these 50 questions, not today, then we will move to bit complex for kidney in our next week session about kidney. So firstly we will do these simple one. Okay, patient with nephrotic syndrome has generalized edema. Which interventions are expected? Select all that apply, guys. So we know nephrotic syndrome is kidney disease, basically where too much protein urea is going on, and that can cause the low albumin level in blood. Okay, so that's why when we have low albumin level, then we see edema. Okay, because of imbalance in osmolarity. Yeah. So daily weight at same time. Hi Cheeto King. Is it good to do at same time or can we change it? Yeah. Okay, so A is good because this is the best indicator of the fluid retention. Even when we give medication such as like diuretic furosemide, it's always recommended to do the daily weight at same time. Okay, strict intake and output. What about B, guys? Is it important to maintain strict input and output? Yes. Okay, because we want to track down how much fluid patient is having and how much fluid patients you know excreting through the V's. So it will give us fluid balance, like whether they are excreting or whether they are retaining, you know. So B is correct. And what about high sodium diet to expand volume? Do we want to give high sodium diet? No, because we know where sodium goes, water goes. Okay, so we the patient already having nephrotic syndrome, edema, and if we will give high sodium diet, the more fluid will be accumulated in the body, and our goal is to get rid of the fluid. And assess for foamy urine. Why patient will have foamy urine in nephrotic syndrome? Thank you, Yoya. Why patient will have foamy urine in nephrotic syndrome? Infection. Protein. Yes, thank you, sunflower. Protein. This is the classical sign of significant proteinuria. Okay, if there is a too much protein in the urine, that's why patient will have foamy urine. So always assess for that, because like then you can see whether nephrotic syndrome is increasing, getting worse or not. And what about administering prescribed ACE inhibitor? Is ACE inhibitor good one? E, guys, E. Yes. How does ACE inhibitor work? We done in our last pharma session. We done. It is nephrotoxic, but like we are having patient with nephrotic syndrome. Come on, guys. Thinking hat on. Vasodilate. Yeah. What else? What is other role of ACE inhibitors? Yeah, the RAS system, renin angiotensin aldosterone system, reduce BO proteinuria. Yes, pros definitely. Okay, if ACE inhibitor are prescribed, it can help us to reduce the proteinuria. Okay, it can help us to reduce the proteinuria. So that's why we gonna say yes to E. Okay. Alrighty. What about F? Elevate admetus extremities. If we are elevating the leg, is it gonna help? F. If somebody is having edema in legs and we are elevating, is it gonna reduce the edema? Yes? Okay, so F is correct also. Alrighty? Yeah. Sweet. Thank you, Noah BNG. Thank you, guys. Okay, let's move to question number 4. Yes, definitely. A Kosovo-ACE inhibitor are used to reduce the proteinuria because they they block the angiotensin, and angiotensin usually work on the efferent arterioles that relax down. It's dilate, okay, and when it is dilating, then the intraglomerular pressure reduce, and that's why there is less damage to the filtration barrier. Okay, when we will have less damage to the filtration barrier, then there will be less protein leak into the urine. Okay, so this is the thing. I know ACE inhibitor cause vasodilation, but it also relax the afferent arterioles also. Okay, so that's how you, because otherwise there will be too much pressure and there will be, yeah, there will be too much pressure and there will be more injury to kidney. And when we have significant kidney injury, then only we lose protein. Okay, otherwise protein molecules are quite big and we don't want to see those into the urine. The only time it happens when there is an injury in kidney. Righty. But thank you for putting that one over there. Really appreciate. Okay, question number 4. The nurse care for a client with the suspected acute glomerulonephritis after a recent streptococcal throat infection. Which assessment findings support the diagnosis? Select all that apply. Okay, we know this is the acute inflammation, especially glomeruli, and usually it happens with the streptococcal infection. Yeah. So, do we have cola colored urine? What about A? Yes. Yes, because there will be, it's the acute injury to the glomeruli, and then we will have presence of red blood cell. Okay, there will be red blood cell in the urine, and that can actually make it cola colored. Okay, what about periorbital edema? Yes. Okay, in acute glomerulonephritis, this is the first sign. Okay, periorbital edema is the first sign that will indicate that patient is retaining the fluid. Okay, so if somebody is having CKD, not CKD, if somebody is having acute glomerulonephritis, this is the first sign. Okay, puffiness around the eyes, swellings around the eyes, severe polyuria. What about C, guys? What about C? Are we gonna see polyuria or are we gonna see oligouria? What we gonna see here? C, no? Yeah. Because we are having yes oligo, because we are having a reduced kidney function in acute glomerulonephritis. There is infection going on, kidney is not working properly, so that's why. Okay, we're gonna see oliguria, not polyuria. Yeah, so this is wrong. And what about hypertension, guys? What about hypertension? We just did that. Yes. Okay, because what's happening, because now kidney functions are not going properly and kidney is retaining too much fluid and electrolytes, that's gonna cause the hypertension. So C or D is yes. And what about proteinuria? Can acute glomerulonephritis cause proteinuria? Yes. Okay. And this is the one of the thing from where it can lead to nephrotic syndrome. So we need to keep eye on this one too. Okay. Do we have positive Murphy sign in patient with acute glomerulonephritis? When we have Murphy sign, F yes. When we have F sign, Murphy sign, which disease it indicate? Anyone? Liver related? Cholecystitis? Yeah. So when we have inflammation of gallbladder, that's when we have inflammation of gallbladder, then you have positive Murphy sign. Okay, you don't have it in acute glomerulonephritis. Okay, so that's when we will see positive Murphy sign. Alrighty, so that's the wrong one. So we're not gonna see polyuria and we're not gonna see Murphy sign over there. Keep double tapping, guys. Thank you. Really appreciate. Let's move to question number 5. Just Barkat Kaur ji, I am. Okay, a client with benign prostatic hyperplasia reports difficulty starting urination and weak stream. Which teaching are appropriate? Select all that apply. Which no ji no nope. What's happening with, so when we have BPH, because this is non-cancerous, this is just the enlargement of prostate gland. So when we know it is non-cancerous, but when it grow, it does pressurize, it put pressure and compress the urethra. So that can cause the obstructive urinary symptoms. So A, is A correct? Yeah. Avoid large, yes, because then it's gonna help us to reduce the overfilling of bladder from becoming overfilled and manage the urgency. Yes. And what about the reducing evening fluid intake? What about B, guys? B, yes. Yes, because it's gonna reduce the nocturia. Okay, and patient doesn't have to pass urine a lot at night. And what about double voiding technique? Anybody know double voiding technique? So double voiding technique is when you, okay, so urinating, waiting, urinating again, repeating. Okay, so this just make sure like bladder is empty completely. Yeah, so patient will go for urination and then wait and then again urination. So yeah. B, so C, yes, yes, C is yes. Okay. Cheeto King, the B is like reducing the evening fluid intake. The only thing is that it will prevent the nocturia and that need to urinate, like, frequency at night. Yeah. Because otherwise patient have lot of what we'll say, um, yeah, he have to get up a lot, he need to go to toilet a lot. What about decrease fiber to limit stool bulk? What about D, guys? Do you know? Yeah, because increasing fiber especially gonna reduce the constipation, and that is the, if patient is constipated, then there will be more strain. Yeah, it make it worse. Okay, so D is actually wrong. Yeah. And what about E, limit caffeine and alcohol? E, yes, because these, especially caffeine, alcohol, they are diuretic. Yeah. And they are also kind of bladder irritant. Yeah. So they are big. Yes. Okay, so we need to teach patient that. And what about tamsulosin? We know tamsulosin is a alpha blocker. And why we want to give it bedtime? Tamsulosin alpha blocker, we want to give at bedtime. Reason behind that, anyone? F, yes, yes. Dizziness, yes, no, BNG. Okay, that's the reason. Okay, because alpha blocker make you dizzy, and taking it at bedtime minimize the side effect. Well done. Yeah. Okay, guys, let's move to question number 6. And I really appreciate who went to subscribe Nursingy on YouTube, because these video will be posted over there. Okay, these video will be posted over there, so make sure you subscribe Nursingy at YouTube. Really appreciate. Okay, the nurse admits a patient with obstructing urethral stone. Which action are priority? Select all that apply. So now we have a kidney stone that moved from the kidney and it's in the ureter. So it's stopping the urine flow. It is causing, severe backflow, and then that can cause the cramp and everything. Okay. Strain all urine for stones. Is A, yes? Yes, 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 definitely yes. Okay, because what's gonna happen if we can see which kind of stone it is, then it can help us to prevent for the further stone formation. Okay, we can treat the disease, what's going on inside. And what about B? Give prescribed NSAID for renal colic if not contraindicated. Yeah, identify stone. What about B, guys? And this is the thing, like I was saying last time also in morning session, that if not contraindicated, then you can give it. Okay, so that's why it's correct. And it is the first line treatment of the pain. So especially when it is associated with the kidney stones, because NSAIDs gonna reduce the inflammation, they're gonna reduce the spasm, they're gonna reduce the pain, so they work in good way and very good with the kidney stones. So if not contraindicated, that's another safety thing over there, so we can give it. Okay, encourage early ambulation. Thank you, Autumn. Encourage early ambulation. See, yes to move stone. Yes. Okay, that's the best rationale. Okay, it can move the stone. Righty. And what about D? Restrict fluid to reduce pressure. Do we wanna encourage the fluid or do we wanna restrict the fluid? Yeah, we wanna encourage the fluid. Okay, so there are more chances like patient can pass the stone easily and flush it. Okay, and what about E, guys? What about E? Apply heat to affected flank. Is it gonna help to reduce the pain? Yes, yes. So heat can actually relax the muscle and reduce the flank pain. So we can try that one, okay? But make sure not too hot because that can cause the burn and increase the injury or cause the injury. But otherwise you can apply heat. Okay, so we can assess that one. Yeah, cold is not. What about prepare for possible lithotripsy? Lithotripsy that we are gonna break the stone. Is it necessary? Yes. Okay. Definitely. If sometimes stones are too big and it will be very hard to pass through the uterus, so that's why we might need it. Okay, and this is not that going for, this is preparing for. So preparing is always good. Okay, so we can prepare for lithotripsy. Nice. Okay, guys, let's move to question number 7. Hopefully we will do 20 question today. That's our um depend Cheeto King depend like there are so many factors which component is accumulating inside the body, how much patient is drinking water, how much, because like if there is a stasis and then patient is having like exposed calcium, or uric acid, so like there can be different factor that can contribute to accumulate those chemicals, and then they are not hereditary, they are not, but they can be related to other diseases. Okay, if somebody have hereditary disease like kidney disease in there, then it can be possible. Okay, like main are calcium and uric acid. I have seen those one. Diet, extra body weight, some health conditions, some supplement medication. Yes, correct. All those things affect stone formation. Okay, now we have patient with hemodialysis who has a left arteriovenous fistula, and we know that we really need fistula because it help for the dialysis access. Which actions are correct? Okay, select all that apply. Do we need to palpate for the thrill and oscillation for Broad each shift? So thrill is vibration, and auscultation we want to see Broad like whooshing sound. Okay, A is correct. Yes. Okay, so A is correct. Okay, if we can't feel the thrill, if we can't hear the whooshing sound, that means there is a clot. Okay, that means there is something blocking. So we want A. A is correct. Okay, what about B, guys? Take BP on the fistula arm for accuracy. Do we use that arm where fistula is? No. Okay, because it can cause a clot and it can damage it. Okay, so we don't want that one. So always other arm. Which kind of band you guys use? I just want to see whether everyone have the same color everywhere, because we can actually put the band on that arm. Do you guys use pink one, or just to make sure like next nurses prepare and they know like we are not gonna use this arm? And what about option C? And no venipunctures or IV in the fistula arm. Is it correct? Is C correct? Yes. Okay. So C is correct because same again, it can damage the fistula. So we need to prevent the functions. So we don't want to use C for that also. So this is correct. Okay. And what about D? Protect arm from tight clothing and restraints. What will happen if there is a tight clothing and restraint? Again, same thing, same rationale. Okay, it can damage the fistula. Okay, because there is less blood flow with restraints, so we don't want to do that. And E, elevate and ice the arm routinely. Yes, lead to clotting, definitely. E, is elevation or ice the arm routinely is a routine care? No. Okay, so E is no, because they can be when we have what we say, when we put ice, there will be vasoconstriction and it will constrict the blood flow, so we don't want to do that. Okay, so E is no. And what about F? Teach patient to report numbness, tingling in the hand. Yes. Okay, what's going over there if patient is reporting tingling and numbness in the hand? Which condition is going in? Electrolyte imbalance, what we typically call it. Anyone? Infiltrate, poor circulation, bad. So it is known as Steele syndrome. Okay, Steele syndrome. Okay, so that means the blood is taken from one side and diverted to another part of the body, because we are stealing, and there is a fistula. So what's happening, we are stealing blood from one side and it's going into the another side. So that's why it called Steele syndrome. Alrighty, and the next part where blood's supposed to go, now having low perfusion, so that's why we see numbness and tingling in that hand. Okay, because there is not enough perfusion now. Yeah, so that is Steele syndrome, and most of the time you can see it. Hi Alfreda, you can see it into fistula, also you can see it into arteriosclerosis, because like there will be less blood going toward into the arteries, so that's why. Okay, so you will see pain, you will see numbness, you will see weakness, everything there when all the symptoms of less blood supply. Okay, question number 8. The provider prescribe medication for a CKD patient. Which prescription should the nurse question? Select all that apply. ACDF. Because now we need to be very careful with CKD. We know in CKD what happen, blood kidneys ability to excrete medication reduce, so there can be lot of accumulation and that can increase the toxicity in the blood. So we need to be very careful like which medication we are giving or not. Okay, magnesium. Is magnesium excreted by ADEF? Yeah, magnesium excreted by kidneys. So yes, so we need to watch out that one, because this magnesium also have very toxic level and it can cause the CNS depression. We discussed that one with preeclampsia also. It can cause muscle weakness. It can cause arrhythmia. Okay, so we don't want too much magnesium accumulating in our body. What about erythropoietin? What about B? Yeah, B is appropriate. Okay, because this is the one of the thing that kidney produce erythropoietin, and we know in CKD patient doesn't have enough ability to produce the erythropoietin, so we need to have that injection to make sure like yeah there is enough blood production in the body, and erythropoietin is going to help with that. What about ACE inhibitor for proteinuria? What about C? We done this question just couple of questions ago. Is it okay to give ACE inhibitor for proteinuria? Yeah, that's okay. Okay, so this is wrong. C is good as long as it's just there for proteinuria, because it's gonna vasodilate afferent atrioles, and then it's gonna reduce the kidney injury, so that will help to keep protein inside the body. Okay, what about potassium chloride? Absolutely not. Yes, no. Okay, we know D, we don't want to give it. Yeah, unless patient, yeah, but like in CKD there is already high risk of hyperkalemia, and if we are giving the supplement then it's gonna increase the toxic level. Okay, it can be dangerously high, so we don't wanna give it. If somebody is questioning, make sure like if somebody prescribed potassium, make sure we question, make sure we check the potassium level, and then we can give it. Because if somebody is really having hypokalemia, then you guys can give it. But if without, there is no indication in the question about hypokalemia, so that's why we don't wanna, okay, we wanna question this one. Savalema with meal. What is savalema? Yes, actually this is the one of the thing we are not gonna question. Okay, this is incorrect. Okay, so this is phosphate binder. This is phosphate binder. So yes, thank you, Martin. In a day. Okay, so this is gonna help when you take it with meal. It bind the phosphate and it help to reduce that one. Okay, and it is appropriate medication for hyperphosphatemia, so that's why this is good. Yes, thank you, Okosovo. And what about NSAIDs daily for arthritis? We are gonna do two more question and then we are gonna take maybe 2-minute break. We are doing good. Just NSAIDs question. NSAIDs bad for kidney? Yes. Okay, NSAIDs are highly nephrotoxic, I can say. And then even though it is prescribed for arthritis, we need to question this one. Okay, because it can increase the kidney damage. Alrighty, well done, you guys are so good. I don't think so you guys need me for this. The nurse provide discharge education for a patient. Yes, just no BNG, no NSAIDs. What did I say? Because we are questioning. I just tick because we are questioning. Okay, that's why I take it yes. This is not the right order. Alrighty, the nurse provide discharge education for a patient with recurrent UTI. Which points are appropriate? Okay, recurrent UTI are very common, especially in the females. So we need to make sure we have proper hygiene, lifestyle habits. They need to prevent the, you know, um, UTI. So void after sexual intercourse. A. Yes, yes, because it's gonna help to flush out the bacteria. So definitely A is correct. And what about wipe from front to back? B, yes, because it's gonna prevent bacteria from the rectum to enter into the urethra. So front to back, yes. And take antibiotics until symptoms improve, then stop. What's gonna happen if we gonna stop? Yeah, we don't wanna stop. What's gonna happen? Antibiotic resistant. Yeah. Vinny, I will show you, just give after next question, I will show you how state questions are made. Okay, I have those one also. Maintain adequate hydration. This is gonna give you really good understanding what we are doing, why we are doing. So these questions are really good. These questions will implement into NCLEX and state exam. Adequate hydration, yes, because we need to flush the urinary tract and we want to make sure we have enough, yeah, urine over there. It will prevent the bacterial growth always. What about E? Avoid douching and scented hygiene product. So if we are not using the scented hygiene product, Vinny, you will be fine. Just question everything. When you are answering everything, question everything. Why I'm saying yes to this one? That is the best way. You will be fine. Okay, this is correct. Yeah, because it can irritate the urethra and it can alter the natural bacteria flora over there. So just avoid. And what about use spermicide for contraception? No, we gonna do. Okay, F. No, yeah, F is no also because what's gonna it's gonna, so E and F, they both gonna affect the normal flora. Okay, okay, so that's why you need that. So this is incorrect. Thank you guys, really appreciate for following and keep double tapping. You guys are doing so good. This is the last question, then we are gonna have 5 minute break or 2 minute break. Just water, dehydration, for kidney functions we need to have enough water. A post renal transplant patient is on tacrolimus. Which findings require immediate follow up? Select all that apply. So we know now post renal transplant, so patient is immunosuppressant. Okay, so patient is immunosuppressed, we need to provide immunosuppressant, like, so this one is immunosuppressant, you know tacrolimus. So what's how is helping to prevent the organ rejection. Okay, what is the side effect? Temperature. What about A, guys? Why we can see temperature in immunosuppressant patient? Why we can see temperature? A, yes. Yes, definitely it is yes. This need require immediate follow-up. Infection and organ rejection. Okay, that's the main thing. That's my main concern with patient with transplant also. Okay, when you have heart transplant, when you have renal transplant, liver transplant, patients are immunocompromised. So that's why temperature will be the indication, like, okay, patient is going toward organ rejection. Yeah, thank you, no BNG. Okay, what about true tracholimius level markedly low? What about B? Is this, what's that in Fahrenheit? Okay, oh my god. Can somebody please convert 38.4 to Fahrenheit? I always, it's very difficult for me. I always struggle with that. Celsius. B no, yes, B is no. Okay, because this one is, if true level is low, then that means like it can increase the risk of organ rejection. But if there is a high level, then it will be more concerning because there will be toxicity. Thank you guys, thank you, really appreciate for the temperature. Gingival hyperplasia, what about gingival hyperplasia? Yeah, so this is not the side effect of these medication. Okay, there is another immunosuppressant, cyclosporine. Okay, that one cause gingival, yes, thank you Alfreda. That one cause gingival hyperplasia. Okay, what about D, blood glucose? Blood glucose 12.8 is markedly high, is hyperglycemia. And why we need to question hyperglycemia? Yes, because immunosuppressant, patient is on immuno, yes. Okay, post transplant diabetes, thank you, patient is just on immunosuppressant, so we need to question this one. Okay, what about new pain tenderness over graft site? E, make sure it's new guys, it's new pain. Everything new is yes, we question everything new. Okay, yeah, infection, so we're gonna question this one. What about mild tremors? Is mild tremor a